Ohio has mostly reopened, but can it stay that way? Joining us on Columbus on the Record this week, Jackie Borchert, Columbus Bureau Chief for the Cincinnati Enquirer, and Andrew Welsh-Huggins, State House correspondent for the Associated Press. We'll get to the latest on the pandemic in a moment, but a new source of tension is rising in the community, tension over race and the police use of force. Hundreds of protesters gathered in downtown Columbus Thursday night. They clashed with police, broke windows at the State House and in downtown buildings. It was one of many protests across the country calling for justice in the case of George Floyd, the Minnesota man who died after a Minneapolis police officer kneeled on his neck during an arrest. Andrew Welsh-Huggins, Governor DeWine held a news conference Friday afternoon. Didn't talk about COVID-19 today much, but he talked about this protest and the arrest and basically what was his message to Ohioans.
Well, I think it was pretty telling the approach he took. He started out by saying that he'd been remiss a day earlier for not talking about this. And then he talked at length about the problem of what happened to George Floyd, how terrible it was, the problem of racism, and he really took that on, sort of apologizing that he hadn't taken a stronger stand and really empathizing with the people that were out there last night. Towards the end, he addressed what had happened and some of the vandalism and the broken windows, but it was clear to him that he made it clear that that was not his concern. That his concern was that he felt what the protesters were saying and that more had to be done to address racism, police bias, and those kinds of things.
And Jackie, I mean, Governor DeWine is a lifelong prosecutor. I mean, he started as a prosecutor. He served as Attorney General. He's a friend of law enforcement. So it was striking that he went police first, police brutality, condemning it first, and then protester damage second.
Yeah, and he touched a lot on his past experience as a prosecutor and as the Attorney General. And basically in saying that was his background, his first thought when he sees an incident of police brutality and violence is there needs to be better training. And where was the training? Your viewers might remember that several years ago, while DeWine was the Attorney General, he oversaw a task force that worked on kind of best practices and training for police brutality, for police violence. And today he said, we need to do more. We need to build on that. The other half of his message, and he very bluntly said this, was African Americans, people of color in Ohio are Ohioans and they matter and they're important, and that he is the governor of all of Ohio. And so that is going to be part of what he does moving forward as well. And
Andrew, this has been a backdrop throughout the whole coronavirus pandemic, is the disparities between the health disparities and the outcomes between African Americans and white Americans. And he formed a task force earlier in the week. He's talked about the disparities. Now you have to pay more attention to it. And this fits right into I think some of the anger that the folks downtown Columbus were feeling and also the folks in Minnesota were feeling.
It does fit in. And DeWine made some very strong statements, a few days ago about this huge disparity in COVID-19 cases, including deaths. African Americans and Hispanics are much more likely to die of it, and he is going to address this front on. The issue is that, and I think DeWine acknowledges this, but the issue is that this has been a problem in, Ohio, the country, everywhere for decades and decades. It has come to the fore once again. We seem to always recognize these disparities when a crisis hits, and to his credit, DeWine wants to do something about it. But the real question is this the kind of effort combined with the anger that we're seeing again that will continue on for a long time? Will we really make a substantial change to how to the minorities and the access to good health that they deserve, that they simply haven't had in the past?
Yeah, between the crisis of coronavirus and then cell phone video showing interactions with police, it highlights issues that need to be addressed and have needed to be addressed for a long time. Let's get to the pandemic. It has just been about 2 weeks since the state lifted most of its stay-at-home orders. Workplaces and stores opened in mid-May. Restaurants, hair salons, they opened about 10 days ago. So if the reopening is going to cause a spike in COVID cases, health experts say it would start to appear right about now. So far, the number of new cases and deaths remains flat. The rate of new hospitalizations is declining. Still, a lot of people are staying home, and of course, businesses and workplaces have implemented safety protocols. Governor DeWine this week was asked if he was comfortable with his decision to allow the state to reopen for business.
I think you also probably will see more people as we open up this economy. People are out more. I think you're going to see more people test positive. So comfort is not where I am. We are at a crucial period of time. We have to open the economy. It was the right thing to do, but we got to be very, very careful.
Jackie Borchert, not exactly a ringing endorsement of his decision to open up the state. It's sort of his whole cautious go slowly into the shopping mall, stay apart, wear your mask, and that's what the message he continues to say.
Well, I think, just in that video that you just showed, we reached a point where our economy is failing, and there's a huge issues that come with high unemployment, lots of mental health issues. We have domestic violence can increase, violence against children goes unreported. There's all sorts of issues, tied into that. And I think the governor has been, he was listening to kind of those concerns as well, and we can't stay shut down forever. So what can we do to both get our economy moving again, but also make sure that we are not exceeding our hospital capacity, that we're not going to see, a spike in deaths or the virus spreading out of control. And so that's what they've tried to do. And I think some, health experts, epidemiologists would and have been saying all along that we need to roll out of this a little bit slower, that none of the states are really at the place where we should be as far as case counts decreasing and other metrics that show that we're improving. But we haven't seen a big spike. We are still at a plateau. We've been at a plateau though for most of April and May.
Yeah, Andrew, I mean, is there the governor and Dr. Amy Acton from the state health department, they say that the spike is coming. Do they have it, and you guys have asked this, but do they have a spike, a bump that would be acceptable, or if we go over that level, they would shut things down again? Is there a number they're looking at, or are they just sort of playing it by ear, Andrew?
Yeah, we haven't been able to pin them down on that. And I think Jackie is right about where we've been. I mean, for a couple of weeks now, we've been sort of stuck on this plateau of around 570 new cases a day. And although in the last day or so that did go up a fair amount, I think we're at this position where the next couple of weeks will be really telling. That will have been a couple of weeks since retail opened and then restaurants fully reopened. We've seen all those images of people not social distancing at restaurants and other places. I think the governor has acknowledged that, in fact, a lot of people aren't wearing masks when they're in stores when he's made that a strong recommendation. In terms of what it would take to put new restrictions in place, I think it would have to be a fairly significant spike, because a lot of people have said, starting with the restaurants, they were okay with being shut down for a while, but what they've all said is that being shut down a second time would be, they just wouldn't be able to tolerate. That would be the end of a lot of businesses.
Jackie, any discussion of shutting down, if say there's a spike in a certain city or a certain part of the state, that they would clamp down on that one section? Could they do that? Again, geography is hard. People don't stay in that one section, but is that a possibility?
Yeah, and I also want to go back to the question you asked, Andrew, that reporters have tried to ask the governor. We've asked the governor several times, like, what metric are you looking at specifically? How much would that need to increase to roll things back? And hasn't given a direct answer, but said that that is still an option on the table. And if we look at other places that have come out of lockdown, South Korea, for example, just this week had an outbreak in a warehouse, and the warehouse was not following the protocol. So when he stands up there and says, we can do this as long as everyone follows these protocols, that's why. Because if you don't, that's where you can have outbreaks and hot spots pop up.
Jackie, you this week and Jesse Balmert wrote a story on how we're lagging in testing compared to other states. Ohio, it's roughly just over 3% of Ohioans have been tested for COVID-19. Still pretty low. That the daily rate is increasing, but it's not where the governor wants it to be. The capacity is there, but the testing's not. What are the reasons why Ohio is still lagging other states as far as testing is concerned?
Well, the governor had said about a month ago that we were getting a bunch of new testing supplies. We'd be able to conduct about 22,000 tests a day by May 27th. And of course, May 27th came and we were only averaging about 8,500 tests a day that were actually being done. So while we have a much higher capacity than we did last month, the tests aren't happening. And we're not sure exactly why. We asked the governor this week, and he couldn't give a precise answer, just that they're working on it. And it seems to me that while we were able to get the tests, a couple things that were standing in the way were the infrastructure to deploy those tests. We don't have in Ohio yet, although this week we saw a big expansion of it, sort of the community testing, the in-community testing that you see in other states. For example, in Kentucky, there are Kroger stores, CVS, Walmarts that are doing testing. They have partnerships either with the state or with a private lab to open up testing. Up until this week, in Ohio, you needed to have a doctor's note to get a test. And you also needed, they had prioritized criteria where if you were in, say, a nursing home, you would get a test. But if you were just someone in the community who maybe went to an office job, went a couple times a week, you weren't necessarily on a priority. So your odds of getting a test were much lower. This week, some changes to that. The state has expanded the criteria so that if you are just someone in the general public who's not a healthcare worker or not elderly, you are a priority, fourth and fifth priority, but still a priority. And also pharmacists can also give permission to get a test taken. So already this week we saw CVS expand testing. The state now has a map on their coronavirus website where they show various test sites across the state where you can call and try to get a test.
And Andrew, the testing is the key because as you open up, if you find a hot spot, you do contact tracing, you could perhaps try to limit it. But testing is not, and that's the thing, that if they do more testing, we're going to see the cases increase in the next couple of weeks. And it's hard to tell, okay, are we seeing more cases because we're testing more? Or are we seeing more cases because more people are getting sick? Is it a combination of the two? It's really going to, if the state does increase testing, it's going to muddy the waters quite a bit if you look at that data point alone.
Well, it will muddy the waters in terms of cases, but I think everyone agrees that until we can really ramp up testing and then as well contact tracing, we just won't have a solid sense of how widespread the coronavirus is in Ohio. And I think we have to put aside, what that will do to the day-to-day numbers. I think everyone agrees that reopening schools, bringing sporting events back, having concerts, having a fully functioning economy, all that is dependent on having this broad knowledge about the spread of the virus in the state and beyond. And we're just not there yet. We don't have that yet. And until we have that, life is not going to be, back to normal. And that's, I think, what we're going to need.
We'll get to it. Nursing homes, they continue to be the most likely places for deadly COVID-19 cases. 70% of Ohio's COVID deaths are connected to nursing homes and other long-term care facilities. The very elderly and frail population, of course, is most vulnerable to the disease, which can spread quickly among residents who live close together, like in nursing homes or assisted living facilities. This week, the governor announced the National Guard will assist nursing homes and meet a new goal of testing every staff member in the state. Andrew Welch, it's just to think of a National Guard having to go into nursing homes to test folks. Testing the staff makes the most sense because they're the ones that have to go in and out and more likely to be carrying new cases of virus. Are there any plans to test residents after the staff?
Well, the plan still is to test all staff members because, as you said, right, who's most likely to bring it in, and then the state still has these strike force teams that go in when they suspect a case. Symptomatic residents will be tested, But one thing I think we have to really focus on is the nursing home. The nursing homes are the hardest hit places, and this is some place that I think the state has lagged in providing information about. It was really not until about 2 weeks ago that, based on analyzing health department data further and pushing for more answers, it wasn't until very recently that we saw these eye-popping numbers of 7 of 10 COVID-19 deaths in Ohio are in long-term care facilities. I mean, that's stunning.
Yeah.
I don't think people had a good sense of that. And so it's good the National Guard is going out on these, they've got these 14 teams of 10 medically trained Guard members going out, and I think that's really good. But this is exposing something that's been around for as long as the pandemic. I mean, the nursing home outbreak in Washington State was very well known, and yet we went for several weeks before this part of the crisis, I think, was really fully understood in Ohio.
And Jackie, we don't really, because of the lack of transparency, we don't know. I mean, there are some nursing homes. We've seen reports of a nursing home in Newark where they kept the whole staff in tight, locked down for 2 months, and they didn't have any cases. I've heard reports of other nursing homes that did similar things, only have one case, or another nursing home is really tight, they have one case. But other nursing homes have many, many cases. There's no way of comparing what one nursing home is doing that another one is not, correct?
Yeah, I think that's fair to say. And, when they presented these numbers, every week they release them. And if you go to the website, there's a couple paragraphs above the numbers saying explicitly, you need to talk to these nursing homes and these assisted living centers to find out what they are doing, and that a large number of cases doesn't necessarily mean that they aren't protecting their residents. It may mean that they had access to widespread testing, and most of the people who they tested ended up being asymptomatic and weren't actually ill, but they had the means and the ability to test widely. And we saw that with the prisons. Yep. The huge case numbers out of the prisons, that if you look at Ohio's cases, there's a huge spike, and that's what it's from. So there's that warning. There's also the warning that you have some places that have the widespread testing, but many do not. And if they get one case, that may be enough for a facility to say, look, we've got one case, so we need to act as though everybody has it and act appropriately and take all the measures as if everybody is already carrying it.
They're going to loosen the restrictions on visitations for some assisted living facilities, or some long-term care facilities, assisted living facilities, and for older adults, and also for developmentally challenged individuals, Andrew. But still, as far as skilled nursing homes, the order is still visitors have to stay away. But I assume that a lot of people want to get in there and see what's going on and just see their loved ones who they haven't seen in 2.5 months.
Yeah, I mean, in those places you mentioned, the governor's authorizing outdoor visits. But, this is a part of the pandemic. A lot of us, I know, are sheltering at home and we're feeling stressed because we don't see people very regularly, but that's nothing compared to residents of nursing homes. I know people, I think we all know people, their mothers or their grandmothers have basically been locked in their rooms for 2.5 months. The only people they see is, the staff when they deliver food, and that's to keep them safe. But mentally, that's so debilitating.
Yeah. And
if there's some way to provide more contact, I think that would only be for the better. But again, this gets back to this whole thing, as you said, that Newark nursing home where the staff essentially was locked in for 2 months. Nobody was going in, nobody was going out. They had a low number of cases. So opening up to contact visiting is probably very good for residents, but it's also going to bring in another risk factor.
Yeah. Let's get to some of the other implications of the COVID-19 pandemic. Supporters of ballot proposals to change Ohio voting laws, legalize marijuana, and raise the state's minimum wage have to go back to the streets if they want voters to decide their issues this fall. A federal appeals court this week overturned a lower court's ruling extending the signature deadline and ordering Ohio to allow groups to collect electronic signatures. So we're back to good old pencil and paper on the street corner or door to door, Jackie, and that's going to be really hard with 2 months to go and people not wanting to interact with other people.
Yeah, it is difficult, and that's why they brought the complaint in the first place, because while we were under a stay-at-home order and also just general fears of getting coronavirus, people were not out, and even people collecting signatures didn't want to be out, and we were being told by the messaging from the state was to stay at home. But in the stay-at-home order was a clear exception for First Amendment activities, and the state successfully argued before judges on the Sixth Circuit that that was an exception that petitioners could have used to go out. Of course, we weren't having festivals. We didn't have election day, and that's a primary election day is probably one of the best days that you could go out and collect signatures, because everybody walking in and out of that polling place is a registered voter, and that signature's got to count.
So Andrew, we haven't heard from these groups officially yet, but this really has to all but kill them. I mean, I don't know. There's really, it's going to be, they have to collect 800,000 signatures each for all intents and purposes to get on the ballot by July 1st. And here it is, almost June 1st. Any word officially from these campaigns if they've given up the ghost?
I don't think they're strategically ready to say that yet. But you're right. This is a Herculean task, and people might be willing to go out and go with their friends to a restaurant, but everybody's usually a little bit skeptical of somebody when they ask for a petition signature to begin with, and now I think it's going to be super difficult. And this may just be one of the casualties of the 2020 pandemic. I mean, there's only so much that you can do under these circumstances.
All right. Of course, how we cast ballots in November remains in question. As of right now, Ohio basically plans to use the same system we've been using. Early voting starts 30 days out from the election. It's a mix of mail-in voting and in-person voting. Then on Tuesday, November 3rd, the rest of us will line up and vote if we haven't already mailed it in. Of course, that might not fit with fears of spreading coronavirus, so groups are calling on Ohio to make the process of voting by mail easier. President Trump falsely claimed that mail-in voting is rife with fraud. Lieutenant Governor Jon Husted, who ran Ohio's elections for 8 years as Secretary of State, says that's not the case here.
I think what some states are talking about is just sending everybody a ballot. It doesn't happen that way in Ohio. You have to request it. It's checked twice to make sure that the person who received the ballot is the one who actually voted. And we also preserve the variety of other tools. And by the way, that system is not changing, and President Trump won Ohio under that system.
So there it is, Andrew. I don't get the feeling that we're going to see a whole lot of changes, at least not yet.
My guess is we'll see pushes for more changes. We might even see lawsuits for more changes. But we're going to see a lot of mail-in absentee voting in Ohio. The system is there to do it. But I think the lieutenant governor is right that we have this system in place already, and now it's just a question of people taking advantage of it.
Jackie, I think the most voting advocates say the state's not going to just mail everybody a ballot like other states do. That's not going to go over in the State House. But how about just mailing every registered voter an application for an absentee ballot? Can the Secretary of State, Frank LaRose, do that on his own? I'm not sure about this. Or does it require act of the legislature to do that?
So that's been up for debate in past years. If you remember back in 2016, there was some thought that the legislature might not approve that the funding for that, for mailing all of those things out. And Democrats said, well, he can just make that decision on his own. And Husted, then Secretary of State, said, well, no, I need to have legislative authority appropriation to do so. But that being said, the General Assembly has done that for general elections to broaden participation. Another thing that is floating around out there that I think has a good chance of being enacted before the election is the ability to apply for an absentee ballot online. I think what this primary election showed a lot of people was, they had to remember how to use the mail. In some cases, they had to look for a stamp. They had to either print off an application, or some people made a call to their board of elections to have them send them one. It just was very clunky, and doing it online seems very feasible and has bipartisan support at the State House.
And Andrew, real quickly, it's local boards, if they get a lot more mail, that's a lot more paper to handle. Are they prepared to do that?
Well, they're still recovering from the primary. I guess they'll have to be prepared to do that. And I do think that is one place where the Secretary of State's office probably could step in. And my guess is, of all the things the legislature might be asked to do, providing a little bit more funding for boards to carry out what's under current laws, that's probably more palatable than some of these other changes. But it's going to be a very interesting summer and fall for these boards.
All right, let's get to our off-the-record final parting shots. Jackie Borchert, we'll start with you.
Well, the Ohio State House, like many businesses, is performing temperature checks, wellness checks as workers and visitors come through their doors. And this week, one legislator, Representative Candace Keller from Butler County, decided that she wasn't going to do that, and it walked right past to get her temperature checked. Now, the Speaker of the House, Larry Householder, did clarify that he can't make his members follow those policies and do what he says, and so she will continue to not get her temperature taken.
Andrew, really quickly, final thought, prediction?
We've written a lot about the prisons and nursing homes with coronavirus, but I continue to get a lot of emails from people who are very concerned about the county jails, and I really think that may be the next story in terms of outbreaks we see and how where this pandemic is hitting the hardest.
That'll do it for this week. Thanks for joining us. Have a good week.